is said that the best classroom in the world is at the foot of an elderly person. Welcome all. Welcome to the last day of International Webinar Series and Elderly Day celebrations of Government College for Women, Aging with Dignity and Respect by the Postgraduate and Research Department of Home Science, Government College for Women, Thiruvananthapuram, Kerala in association with Unnat Bharat Abhiyan and Home Science Association of India, Kerala chapter. Today's session is on Ageism at Crossroads, Challenges and Opportunities during COVID Pandemic by Dr. Nisha Sheen. Before moving to the webinar, I humbly request all the participants to strictly follow the guidelines of the webinar. Kindly avoid greeting messages in the chat box and use it only for raising your queries. Make sure that your audio and video are muted for the better quality of the program. The feedback form will be shared towards the end of the session. First of all, let me invite Dr. Minnie Joseph, who is the head of the Department of Home Science, Government College for Women, Thiruvananthapuram, for welcoming all of you. Ma'am, over to you.
It's a great pleasure to be with you all this evening, and extremely pleased and proud to have Dr. Nisha Sheen with us this evening. Welcome, Nisha. It's so lovely to have you with us again. She is a faculty of the Department of Home Science, and we're very proud of you, Nisha, and thankful to you for being with us. We welcome all the participants also, and have a great evening. Thank you.
Thank you, Minnie Madam. Before moving to the session, I would like to call Mrs. Shifa J, Research Scholar, Department of Home Science, Government College for Women, for introducing the resource person of the day. Over to you, Madam.
Thank you, Adira. Good evening, all. Let me introduce Dr. Nisha Sheen. She is a dedicated professional and educator committed to teaching and research. In various arenas help her to work in adverse and diverse socio-cultural backgrounds across different countries. She got her master's degree in extension education and her doctorate from the University of Kerala. She got certifications in various programs which include Human Subject Research Training from the University of Utah, USA, Hi-Fi Training Program focusing on older adults from the Parks and Recreation in Toronto, Canada, TCPS2, which deals with ethical conduct of research, including humans, and Fundamentals in University Teaching from the University of Waterloo, Ontario. She has done volunteer works with various agencies across Canada and is also a professional member of Parks and Recreation Ontario and Canadian Association of Gerontology, Toronto. She has a teaching career that spans over 15 years and is currently a research collaborator with the Carleton University, Ottawa, and part-time professor at the St. College, Ontario. Let's welcome Dr. Nisha Sheen to share her thoughts on today's topic. Over to you, ma'am.
So good evening, everyone. Thank you, Shifa, for the kind introduction. And I'm very excited and humbled and privileged to be back to give a talk to my alma mater, the same place where I spent almost 5 years of my teaching until I took a break. And I'm so happy to reconnect with you all. So today's topic, October 1st was World International Day of Older Adults. And the United Nations has declared this 2020 to 2030, the coming decade, as the completely dedicated to for the well-being of older adults. So in this context, and ever since this COVID pandemic that struck us in the early months of 2020, ever since we have been flooded with the academy has switched to this online learning, and so we have seen a surge of flood of webinars going across different platforms. So everything has been discussing about this COVID pandemic and all the related scenario. So in this context, I would like to talk about a bit about the ageism and how this COVID pandemic has impacted the older adults, because we know ever the COVID pandemic had hit mostly the older population, and so that requires special attention. So we need to um, come up with more discourses related to this COVID pandemic and how it's impacting the lives of older adults. So today I'm going to talk a bit about ageism and how this ageism it is at crossroads. Means it can be aggravated, or there we can find opportunities to improve from this COVID pandemic. So how the challenges, there are many innumerous challenges the older adults are facing due to this COVID pandemic. And so we are just going to drill down through some of these challenges and how we have to explore the opportunities, because for every negative, every pandemic or any calamity or any situation, we have some silver linings, because there are not only negative things, we have something left to explore from that challenges. So I'm going to discuss about few silver linings or few challenge opportunities which we can explore from these pandemic that can help improve the lives of older adults. So that's today's topic. So everyone who are there to for attending this webinar, thanks for joining. And so let's move on. So let's start now. In the auspices of the onset of United Nations declaration that 2020-2030 will be the decade of healthy aging, we continue with discourses and efforts to spread the dire necessity of providing value and support to older adults, to celebrate their diversity, to refute ageism, to reduce the inequalities, and provide age-friendly environment for their better quality of life. We know today there are around 600 million people aged 60 years and over worldwide. This number will double by 2025 and will reach 2 billion by 2050, with the vast majority of older people in the developing world. So, what's ageism? Let's start with ageism. Despite all the contributions and actions older adults have made to their communities and family members, there is still a lot of stereotyping, prejudices, and discrimination towards people based on their age. That's what we call ageism. It's in simple terms, it's the unfair prejudice or discrimination on the grounds of a person's age. Ageism can affect people of all ages, but has particularly deleterious effects on the health and well-being of older people. Ageism is a kind of stereotyping, prejudice, and discrimination against people on the basis of their age, and is an everyday challenge for the older people. It can be as a restriction from employment or social services, and is much stereotyped in the media. Ageism marginalizes and excludes older people in their communities. These are some of the common phrases we hear, like in regards to ageism. We see that, oh, these people are too old, they are like they're coffin dodger, they are too ancient. We call them like grandma or grandpa. The terms we call them dinosaurs. It depends across different cultures. Socially ingrained ageism can become self fulfilling by promoting in older people the stereotypes of social isolation, physical and cognitive decline, lack of physical activity, and economic burden. Aging can happen to all of us, and ageism is an international issue. During his speech on the rights of older people under its COVID-19 response, the United Nations Secretary General Antonio Guterres stated that older people have the same rights to life and health as everyone else. So, ageism can be either positive or negative. Stereotypes about older people are almost always negative than they are positive. These stereotypes and attitudes are socially constructed, shaped, reflected, and reproduced in the language that we use, both in our everyday lives and in a range of different contexts such as the media and policy. See, for example, like after the emergence of the COVID pandemic, the media and in some social media platforms, we saw the terms like this is a zero pandemic because it's focused or it's aiming at the older population, or it's like a boomer remover because older people are often referred to as boomers. So it's this COVID pandemic is sometimes referred to as boomer remover, which is all a version of negative ageism. Although there is substantial evidence that many contributions that older people make to our societies, they are frequently stereotyped as dependent, they are referred to as frail, out of touch, or a burden in the family or community. This ageist attitude limits older people's freedom to live their lives they choose and pose threats on their well-being. We know the world is grappling with the COVID-19 crisis, and we know that older adults have become one of the most visible victims. Even though the pandemic contracts persons of all ages, evidence indicates that the older persons with already underlying medical conditions are at a higher risk of serious illness and death from COVID. Thus, this proliferating pandemic has posed many challenges to the lives of elderly across the countries, which calls for immediate and ongoing attention and needs to be addressed strategically. So today, I want to put to this context the most direct challenges confronted by older adults that has stemmed out from this COVID pandemic. Some have suggested that ageism may have significantly contributed to the detrimental effects of health and longevity of the older adults with COVID. To give you a more vivid picture, I'm going to walk you through this table. The contents listed, which demonstrate some horrific situations in the nursing homes and long-term care facilities in various parts of the world at the onset of COVID. So here in this table, I have highlighted the grave situations. You must have come across these through the media. So ever since the outbreak, we came across these news that in some countries, the co-ops and seniors were abandoned in some long-term care homes. Many patients were taken care by staff who were not instructed to wear protective masks because of the assumption that it will scare the residents. Some infected nurses were still working in some hospitals and long-term cares despite the symptoms. And there were some mass deaths in some Swedish elder care homes. And we can see they were often characterized as sacrificial lambs. And some hospitals in Italy and some other countries, they stopped admitting the elderly patients with coronavirus. And many of them were refused access to hospital and life-saving equipment, saying that it was like prioritized for the younger generations. And even in Hamilton, in Ontario, during a long-term care transfer, one male patient was forgotten and left entirely by himself during the process. So these are instances where the most heinous incidents and situations where elderly people or older peoples are neglected during in the context of COVID pandemic. So let's move on to discuss some of the major challenges faced by elderly during this pandemic. These are some of the major challenges. Can be social isolation, loneliness, and anxiety, followed by depression, dementia, digital divide, that's the technological divide. The elderly abuse is another challenge, food insecurity, race and gender inequalities, disproportionate death rate across the world, suicide cases. There are a lot of financial scams happening around this pandemic scenario, and the issues of caregivers. So the main and the most hit challenges are social isolation, loneliness, and depression. We know that as the COVID pandemic called for physical and social distancing, an increased number of older adults, they started getting socially isolated. They were confined to their homes. And so prior to this disease outbreak, we know that a vast majority of these people were actively engaged in social activities. They used to go out, they used to attend senior centers, religious institutions, outdoor activities, they used to travel and participate in many social events. However, due to this lockdown policy, most of these services and programs were no longer available as earlier, and apparently these restrictions increased their social isolation and the feelings of loneliness in the older adults. So we know that social isolation and loneliness, irrespective of age, have been linked to our negative physical and mental outcomes such as increased depression and anxiety, increased risk of hypertension, cardiovascular disease, obesity, cognitive decline, and even death. So, to add to this, I can also mention that the pandemic crisis has also revealed the ingrained ageism and the age stereotyping in the society. We know that aging is the greatest contributing factor towards the risk of developing COVID-19. Therefore, protection of the vulnerable elderly populations, particularly those with loneliness, isolation, and dementia from COVID, and managing the long term effects requires urgent attention. The elderly has been hit hardest with the highest rate of incidence, the most serious symptoms, and the highest death rate. According to evidence, a considerable portion of older adults living in care facilities have Alzheimer's disease or other forms of dementia, which makes it more difficult to contain the possible infections with the new coronavirus. One of the specific challenges for people living with dementia and similar forms of cognitive impairment is that they may have difficulty in understanding the dangers of this infection. Also, they may forget to follow the safety precautions such as washing their hands, sanitizing, or practicing physical distancing. Besides, those who care for people with dementia and have contracted the virus may also avoid seeking treatment or being hospitalized because they cannot afford to leave their elders alone at home. On the other hand, people with dementia themselves who have COVID-19 and need hospitalization may avoid it because they fear that due to the hospital triaging protocols, they may fall at the bottom of the ladder when it comes to receiving medical resources and attention. Furthermore, people may be discouraged from seeking medical attention for dementia because memory clinics are shutting as seeing new patients is perceived to be riskier than for some people not to receive a dementia diagnosis. Digital divide to connect is another challenge encountered by the elderly during the COVID. The term digital divide refers to the tendency of older adults to be less likely to use internet than the younger people, and for those older adults who do not have access to internet or devices. Within the population of older adults, internet adoption rates vary by age, ethnicity, education, and income. As already we mentioned, older adults experience social isolation as a result of not being able to have visitors at home and not being able to go out and do things with other people. So, in this context, digital media such as social networking sites, video chats, and online games can help people stay socially connected. But unfortunately, all older adults are not currently well positioned to take advantage of these digital technologies. Older adults, once online, they are also targeted by misinformation, overload, and fraud. We can see that many lower income older people have pay per minute phone plans, for example, and may have to choose between using their limited minutes for a phone call with a doctor or a conversation with a grandchild. So we cannot assume that a switch to virtual socialization or virtual access to resources is going to work for all older people, especially in the rural areas. But interestingly, there's a study, recent studies show that one third of adults 65 or older in the United States declared never using an internet. Data in the United Kingdom also indicate that more than half of the adults who have never used internet in the country are aged 75 years and over, with a higher proportion of older men using the internet than women. This digital gap can also affect the ability of older persons to make use of services such as telemedicine, online shopping, or grocery shopping, which could prove crucial where these physical distancing restrictions are implemented. In low income and other developing countries, technological challenges for older persons are thus exacerbated. But there is an amazing finding from a study in India regarding the use of internet by older adults. It says that prior to the pandemic, the share of internet users in the 55 plus age group was only 68%, and it suddenly shot up to 30% in 6 months. According to the further estimates, over one third of the first time users of several digital platforms during the pandemic belong to the 55 plus cohort. So we have the findings of contradicting studies saying regarding the usage of internet and these digital platforms by the older adults. But still, there are millions of people in India who doesn't have access to devices or internet. Another challenge is the elderly abuse. It's really shocking and concerning challenge. Emerging reports have shown that lockdowns raise the risk of abuse among older people. During the pandemic, older adults have become even more dependent on their caregivers and in a pattern similar to the one that has raised the rates of domestic violence. Some caregivers have used this pandemic to exercise their control and abuse further on the older people. Elder abuse tends to occur more frequently in communities that lack mental health or social care resources. According to a recent paper appearing in a journal, it says that people who experience elder abuse are more likely to develop mental and health problems such as depression, high level of stress, and self neglect, conditions that can be only made worse by the lockdowns. So, overall, the lockdown means that more elderly people are trapped with abusers, and there's a high need for mental health and community support services. Food insecurity is another concern, especially for older persons who are quarantined, isolated, and without safety nets and within the limited funds. Even before the novel coronavirus surfaced, millions of older adults struggle with food insecurity. The COVID-19 pandemic has further compounded their ability to obtain healthy food or eat balanced or nutritious meals. One reason is that older adults who rely on food banks or senior centers in some countries for a daily meal or some socialization, they find themselves shut indoors due to this lockdown or physical or social distancing, and they are unable to access the nutrition programs. They are fearful of trips to supermarkets to buy their grocery or without adequate finances and other needs. Even social isolation can expose these older adults to an increased risk of nutritional deficiency. The institutionalized older adults often depend on food donations, which we have reduced due to the economic crisis caused by the pandemic. And the aging process itself caused changes in nutritional necessities and eating habits. In the coronavirus pandemic, what the nutritionists and dietitians can offer is to do the remote nutritional follow up. Moreover, the government actions such as the implementation of educational and social service programs should be applied to support healthy aging and minimize the exposure to nutritional risk and coronavirus disease. However, these recommendations fail to address the struggle of millions of low-income older adults who lack the access to healthy food and adequate nutrition on a daily basis. Even millions of people also typically they cannot afford to stock up on food or supplies, and even if they can, they might need transportation assistance to and from grocery stores. Another challenge is the race and gender inequalities. The COVID-19 pandemic has exacerbated the older person's experience of multiple and intersecting forms of discrimination. Older women always falls behind in accessing healthcare due to the bulk of their care in households, their ability to continue doing so without endangering their own health. Besides, persons with disabilities aged 60 and over generally have more healthcare needs that make them more vulnerable to the symptoms from COVID-19. So, as a result, the challenges in access to healthcare and other services impact them more than the general population. This pandemic has revealed how the pre-existing health inequalities play a role in the COVID-19 outcomes. For instance, initial data from the United States suggests that the African American populations, irrespective of age, they might be disproportionately affected by the COVID-19. Older persons that live in low and middle income countries, especially those in conflict and crisis settings, face increased risk to poor access to healthcare and other social services. So, global inequalities mean that already pre COVID-19, as many as half of older persons in some developing countries did not have access to health services. Older adults are more likely to have the dire outcomes from the virus. We also have to think about all of the ways that the pandemic affects older people's lives beyond morbidity and mortality from the virus itself. There's growing evidence from various parts of the world about the disproportionate death and dying among older people. Over 90% of death rates due to COVID were of individuals 60 years or older, and more than 50% were above 80. Residential care homes, including these long-term care, old age homes, and assisted living homes, have been hit especially hard and account for more than half of the pandemic-related deaths worldwide. Close quarters living and limited access to personal protective equipment increase the risk of transmission, which, together with healthcare challenges which are associated with staffing shortages, results in multiple fatalities. The numbers of deaths are troubling, but even more disconcerting are seemingly the endless stories of neglect and mismanagement that have appeared to be costing people their lives. Reports from various sources state that some seniors did not even have dignified deaths, indicating that they have gone for days and days without water, food, or even a diaper change. More generally, actual occurrences include refusals to hospitals to provide treatments, improper treatment of deceased elders, and sending patients confirmed to have virus back to their nursing homes, thereby increasing the risk for elderly adults. Suicide is another challenge. Suicide prevention researchers and public health experts have warned the public of a substantial increase in suicide rates among the older adults during the COVID. It's related to the increased fear of COVID and despair, the restriction to physical access to social supports and mental health care programs, on top of that, the financial anxiety. Recently, concerns have been expressed about the anticipated spike in suicide behavior and deaths among older adults as a result of this pandemic. The Royal College of Psychiatrists has just estimated that there would be a six-fold increase in the suicide attempts among older adults. In India, more than 300 suicides were reported during the lockdown as non-coronavirus deaths due to mental torment, where 80 people killed themselves due to the fear of being infected and loneliness. This emerging situation puts the mental health of the elderly at higher risk, and those who are already suffering from mental disorders are more vulnerable to COVID pandemic. And the social consequences of COVID-19 have invigorated them to choose to end their lives. The information overflow about the consequences of COVID-19 for the elderly, proclaimed by the various news channels and the social media platforms, also paved the way to the development of their anxiety.
अच्छा फोन देना मुझे बोलना एयरफोन लेना
Some very views of ageism in general have been expressed during pandemics, often signified by referring to them as
करने का
boomer
भी
in
होने वाला है
grandma killer and zero pandemic, as I already mentioned. It
हाँ
has
होने
been
वाला है
observed that
उसका
older people are made to feel less human as individuals by policies that characterize all older people as the same, reflect the heterogeneity and varying levels of functioning and vitality among them. This too can be regarded as a contributor to why we think of like ageism as being at financial and other seniors during the Financial and other scams are another threat to seniors during this pandemic. Seniors are often approached by strangers at stores. They offer to shop and deliver groceries for them. They will ask the seniors for money and their home address, but they never deliver or even set up an arrangement to deliver. Some people may offer to test seniors or sell at-home testing kits. They may go door to door and quickly swab the new senior's nose and then ask for money, or they will call seniors and offer to come to their home, gathering some personal and financial information. They may also ask for payment over the phone, offering to mail them out an at-home test kit. The scammers will also ask seniors to donate money for fake charities. Such similar situations are also reported in the Kerala scenario. They also try to sell sanitizing products, N95 respiratory masks, and other supplies that are in high demand, but just pocket the money. The Last but not the least, the issues of the caregivers are another is another challenge during this COVID pandemic. There are two separate caregiving scenarios. There's a caregiver at home. It can be their children or grandchildren or the relatives with the person, and the caregivers in the old age home or long-term care homes. When we look at the data, people who live with the person they are caring for feel more isolated. It's not just the physical proximity to the people that matters. What matters is the ability to have the real connection with other humans. Going for a walk around the block or participating in an appropriately socially distant activity is quite important because people need human interaction. On the other hand, there are long distance caregivers, the people who are not in the same place as the person they are caring for. Communication plays an important role for these caregivers. We should make sure that we are communicating frequently with the person that you are taking care of and we are understanding what their needs are and how we are managing their care plan. That's where the virtual media can again help. Taken together, the combination of mental and physical health issues, social disconnectedness with isolation and depression, financial scams, food insecurity, and inequalities leaves adults over the age 65 in a very precarious position. So, countries can learn lessons from this crisis on how to build and improve the social and elderly care systems, as a post on Twitter. So, I want to put to this context the opportunities for improving the lives of older adults that may arise from the challenges stemming from the COVID-19 pandemic. These opportunities pertain to increased connectivity through technology, family, health, and support services to improve their quality of life by reducing social isolation, increasing self care and management, and improving the awareness of advanced directives. There may also be opportunities to address the shortage of caregivers, volunteers, and professionals specializing in the field of aging. I would also like to mention the other silver linings associated with the pandemic. Research has shown that many older adults were urged to learn new technology skills and are particularly motivated to use these skills where they see a need for it. We saw that as using the Zoom calls, Skype to carry out work or meet family, friends, and relatives. They use these social platforms to order groceries. They do take exercise and yoga classes online and even talk to healthcare providers. This has been an opportunity for older adults to get more comfortable using this technology and for the community and healthcare providers to offer remote programming. COVID has also made us reimagine and instigated the dire necessity to ensure that the living space of older adults are age friendly. What I'm trying to highlight is how this outbreak has changed how we think and act towards our shift in lifestyle patterns. Multiple sources are calling attention to the importance of schedules, sleep, diet, exercise, social connection, and self care skills that are surfacing as truly important on a daily basis. There's also a call for innovative research and training in this field. Our society has come to realize that our response to preparing for, managing, and eradicating COVID-19 has been grossly inadequate. We need to continue to develop innovative ways to provide this necessary supports to older adults who are most at risk and to learn from the most resilient. We also need to learn from the crisis for the future, especially examining the positive adaptation of people and society, what we might call COVID-19 resilience. So, understanding the nexus of risk, vulnerability, and resilience has the potential to identify key questions for research and shape a path forward. So, what we require is surveillance, innovative research, and trainings, which are fundamental. This crisis has provided new opportunities for mobilizing the community of aging related basic and applied researchers, as well as a spectrum of program and policymakers to generate innovation in knowledge and its translation. Despite these challenges, older adults possess many important strengths. For example, older individuals tend to gain significantly more daily free time as they retire, meaning that they may have more flexibility than others to make use of this time. With the right support, older adults could combine modern resources with a lifetime of experience. Thereby, they can make judgments about individuals and situations to play a key role in reducing misinformation during this COVID. These older adults also possess qualities that might help them remain resilient during social distancing. Compared to younger people, older individuals are more practiced in supporting themselves in daily life. They are less likely to need to relocate geographically and less likely to be severely negatively impacted financially. Of course, there are exceptions for these cases. This is a general statement. So, older adults are also especially good at regulating their emotions. So, taken together, these strengths of older adults suggest that they may be better suited to endure the unprecedented coronavirus pandemic and the new reality of social distancing than other demographics. This is also a juncture for mobilizing the young volunteers. Several countries have organized volunteer telephone support services to help connect with older adults. In Ireland, a program called Friends of the Elderly schedules regular phone calls between older adults and trained part-time volunteers. A similar program in Canada called Friendly Phone Program is organized by the local Red Cross. It matches seniors with volunteers who call for weekly check-ins. Also in Canada, the Alberta Senior Center Without Walls is a free phone-based program that offers recreational activities, health and well-being programs, and friendly conversations with senior adults. In Australia, a national non-profit Friends for Good offers a telephone hotline and online chat for anyone who is lonely, regardless of age. Trained volunteers are available to engage immediately, avoiding any delay in getting connected. Besides, the elderly can also serve as volunteers during this period of social and physical distancing. Their wealth of knowledge and wisdom and endurance with those they can help the other younger generations in coping with this COVID pandemic crisis. Technology can to a large extent assist older adults and caregivers in response to this pandemic and enhance their well-being moving forward. So, this COVID 19 is an alarm bell reminding us that urgent attention should be paid to improve technology literacy among older people, as well as support caregivers and healthcare professionals to use these technological innovations as a complementary tool for delivering care services. That's what we call general technology. So it's imperative for policymakers to develop the best practices and public policies to ensure that appropriate, effective, and of general technology is being carried out. Issues that must be addressed includes accessibility and usability for vulnerable groups, the licensure and credentials of telehealth in crisis, payment of digital service cost, and insurance reimbursement and protection of data privacy and security, especially while the older adults are using this. To add to an example, a Norwegian company recently developed a one-button computer. It's designed to help people with no experience using smartphones or computers. So with just an internet connection and a power outlet, it can stream photos, send or receive messages, and conduct video calls. Currently, this product is available in 8 European countries and it's of much help during this COVID pandemic. Another option is working from home during pandemics. Even without a global pandemic, working remotely can be a great option for people who are looking to ease out of a traditional full-time job but aren't ready to give up work altogether. So during this COVID pandemic, we have teachers, retired professionals, or in different sectors of employment, they can switch back to work. They can work from their comforts of their own home within their availability of resources. The removal of geographical limitations is an advantage for many older workers. This working from home is flexible. Remote working also widens the talent pool with people able to apply for jobs that aren't in their immediate area and could go somewhere towards addressing unconscious bias older workers may experience in an office or interview settings. Research also shows that older workers are more committed and loyal. So, recruiting older workers can provide continuity and stability for an organization, while they also offer a lifetime's worth of experience and expertise to support both the leadership and wider team. So, that's all about the opportunities that can arise from this pandemic crisis. So, I would like to conclude with these 6 key takeaways. COVID-19 is having specific effects on older adults. Older adults have felt the effects of COVID-19 in profound ways like access to clear information, support and services, technology, food and medication, and it has been a challenge for many across the globe. So it has exacerbated the already existing vulnerabilities. So that's the background situation. So we must take care of our communities and home and communities, and we should make it more age friendly as we move forward. Building resilient houses and cities to allow seniors to age in place is very essential. Age friendly environments are better places in which to grow, they can live, they can work, play, and age, which means an age friendly community is a better place for all age groups. Old age homes, long term care homes, nursing homes, and assisted living homes requires a revamping in terms of care services as well as infrastructure and staffing. Besides, public spaces like streets, walkways, and parks and other buildings should be safe for people for all ages. Behind the closed doors, there are many seniors that are still suffering. Some are still dying daily in care facilities in horrific conditions, as we already discussed at the onset. There are seniors experiencing housing instability, homelessness, and mental challenges and poverty. There are racialized seniors, isolated seniors, and seniors with disabilities facing incredible inequity. So, the policies and frameworks and resources infrastructure should be focusing on addressing these inequities in our systems and prioritize the most marginalized people. It's high time to fix the healthcare system. Most healthcare systems were designed in a time when with different care needs, and as such, it is necessary that we find ways to adapt to the future. So this COVID pandemic is like an eye opener. It's high time to realize the gaps in the system and to fix them. Solutions have been proposed for many years, and we now need to implement them in terms of staffing, the infrastructure, the adequacy of care, interdisciplinary care, and the model of care. Collaboration is very essential for supporting seniors. Creating the best living conditions for older adults demands collaborative actions across different orders of the government and government agencies, various community organizations, researchers, schools, colleges, universities, and the advocates for older adults. So we need to appreciate our interdependencies. Support for seniors is needed in all arenas and must be targeted at all levels. It's also better to integrate the experiences of different countries. Intercultural collaborations are also important. Lastly, society should address the existing deep-seated inequalities and age discrimination and advocate for older persons' autonomy, independence, and a stronger protection of access to social services. It can be social protection and the human rights. So the government should need to ensure that older persons are consulted and participated in policy decisions that affect their life and must put in place the supportive measures that guarantee their inclusion. So to conclude, COVID-19 is causing unprecedented upheaval across the world. The value of respect for older persons is deeply ingrained in societies across the world. That's because of the deeply held gratitude towards our parents and mentors, the value and wisdom of experience, and because of their much valued contribution to our communities. So it's important to ensure proper planning and investment for societies and caring environments that foster healthy aging and the human rights and dignity of older persons. This pandemic has brought unprecedented challenges to humanity and presents a disproportionate threat to health, lives, rights, and well being of older persons. Hence, it is crucial to minimize these risks by addressing the needs and human rights of older persons to fight the pandemic. At the same time, many of these risks are not new. Older people have long been subject to inadequate protection of their rights and overlooked in national policies and programs. COVID-19 recovery is an opportunity to set the stage for more inclusive, equitable, and age-friendly society anchored in human rights and guided by the shared promise of the 2030 Agenda for Sustainable Development to leave no one behind. Thank you.
Thank you, Dr. Nisha Sheen, madam, for your wonderful presentation. Now, the session is open for discussion. Participants are kindly requested to post your queries in the chat box. Ma'am, first question is, what differences in challenges you find among people living in institutions and those living in alone? Are there any differences?
Can you please repeat that question? So it's about the differences in those living in families and those living in old age homes, or can you
Yes,
please
ma'am, I
repeat
will
that?
repeat. Yes, ma'am, sure. What differences in challenges you find among people living in institutions and those living alone? Are there any differences?
Yeah, absolutely. There are differences because from the narrations I already presented here, we can see that in institutional care is totally different from the care in the families. So even if they are living alone in their families, it depends on their abilities, their physical and cognitive abilities. If they are independent, if they are able to lead an independent life, they can do their activities of daily living by themselves. The challenges are not that prominent. So if we compare those with those generally those who go to institutions like long-term care or old age homes are those find it challenging or difficult to live independently in their homes or by themselves. So uh, obviously in institutions they have tailored or structured care. They have the nurses, they have the personal caregivers, they have dietitians, they have recreational programmers, rehab therapists, physiotherapists. They have all the facilities available in the institutions, but still there are challenges. But those living in home alone, they have more challenges in terms of social isolation. Uh, all those challenges I have mentioned in this presentation, they can face this issue of social isolation, depression, loneliness. It aggravates if they don't have any uh, connectivity to these devices or internet. They will be like out of touch with the external world. They may not have the family members close with them because of this social distancing and physical distancing implications. And they have the tendency because this loneliness, depression, and isolation can aggravate their already existing chronic illnesses. If they have any, it might um, it might pay way to more depression, and even when they might think about suicide, there are chances. And there'll be nutritional inadequacies. They may not be able to cook for themselves. They'll not be able to go around. They'll have this food and nutritional insecurities, technological digital divide. They'll face social isolation. The challenges will be more. In short, the challenges faced by older adults who are living alone in their families will be comparatively more than those living in institutions, because in institutions they have 24 bar 7 care and attention. Even though there may be some pitfalls in those care, we found that in long-term care the majority of deaths were found in long-term care homes. But still I believe those living by themselves have more challenges. Thank you.
Thank you, ma'am. My next question is, how do you see the role of volunteers in improving the quality of life of the aged?
Yeah, absolutely. The volunteering, because this COVID pandemic has exposed the systemic gaps. We realized that we are in short of staff in hospitals, long-term cares, and in the community. So what we can do is that, depending on the economic situation of each country, the organizations or hospitals may not be able to hire more professionals, healthcare professionals. So in this context, what we can do as individuals or as community organizations, we can recruit more volunteers. So volunteering is the best thing you can do. Those who are willing or those who are capable of doing this voluntary services, it can be students, as students can do, or any individuals in the society can offer volunteering. So it's different. Like, even we cannot we need to get training before doing this volunteering. So volunteers can offer their time and resources and services to these older adults who are in distress during this COVID pandemic. I came across the news article that in Kerala, through the Kudumbashree and the Ayal Kutam, a lot of volunteers were recruited, and they approached the older adults who are living in who are isolated in their families. They visited them on a weekly basis, and it was really helpful in this scenario. So volunteering is one of the best practices that can help, not only in this situation, throughout. Thank you.
Thank you, ma'am. Next question is there any gender differences among the caregivers in Canada?
Yeah, not only in Canada, I think across the world, it is women are, it's not about stereotyping, women are considered as the best caregivers because that's why we see in even in families, it's a social structure, or it maybe because women are giving birth to their younger ones and taking care of their mothers. As mothers, their touch of care is more appreciated than men. Not for any offense. So we can see it in this system that more caregivers, nurses, personal support workers, these volunteers are more of women. Even in Canada or in any part of the world, we can see that caregivers are more, even in families, the caregivers are more of women. So there's a gender difference. It is assumed or it is generally accepted that women have that gentle touch of care. They care more than men. And that's why there's a gender gap.
Thank you, ma'am. Next question is, how can people free themselves of myths and stereotypes about aging?
Sorry, can you repeat that, please?
Yes, ma'am. How can people free, free themselves of myths and stereotypes about? Is it clear, ma'am?
Yeah, thank you.
Okay, ma'am.
So, yeah, of course, there are a lot of myths and stereotyping about aging. That one such is about the core content of today's talk is ageism. So, as I mentioned, ageism can be positive and negative. The negative ageism is that it's a general assumption that older people are weak, they are frail, they have reached the last phase of their life, and they are ready to leave the world. They are immobile, they are fragile, um, they're not able to provide care, support, or other services. That's why there is a retirement age. It varies across different cultures. So that's a myth that because the retirement age is said that after 55, it's assumed that after 55 they cannot work, they cannot be as productive as the previous years. So that's one stereotype. Um, uh, so creating and spreading awareness is one way of eradicating or reducing these myths and stereotypes in the society. So we should advocate for positive ageism. Positive ageism is that, I mentioned in the challenge and the opportunities in this talk, like we have to find the silver linings. Not only during this COVID pandemic, in general, we have to find the positives from this. From any aspect. Say, for example, we should appreciate the old adults that they are powerhouses of wisdom and knowledge. So we can gain. They have a lot of experience, worldly experience. We can make use of their resources. They should be valued and treasured. We should like all the services should be inclusive and equitable, like when there should be provisions for seniors, whether it's at a groceries. So for example, at the outbreak of COVID, most of the stores had restructured their store timings, and in Canada we found that the first 2 hours of a day was reserved for older adults. It was exclusive for older adults. It was the time for their shopping. So that's reserving some time, giving priority for them. That can be a kind of positive ageism, spreading the positive ageism. So creating awareness through talks like this, webinars, through discussions. So students and volunteers, you can spread this spirit of positive aging. You can eliminate this negative stereotyping and myths through general awareness classes. You can go to the community, talk with them, make through different campaigns and programs. You can spread the message.
Thank you, ma'am. Next question is, how do employment opportunities after retirement affect the standard of living?
Is that the employment opportunities or the employment status?
Employment opportunities.
That's a tricky question. What I understand is that how the employment status of a person affect the standard of living. Of course, it's one of the social employment status, or a person's financial ability or financial status is a social determinant of one person's health, because it determines the person's ability to access the resources, to make use of the resources, be it housing, having a balanced and nutritious diet, clothing, education, all the other factors are dependent upon a person's employment or financial status. That's how it affects the person's standard of living. That's why there's disparity between different age groups or across countries, across cultures. Depends on the economic structure of the country as well as the community, or if it's about a particular person, it depends upon this financial or economic background. That's why we, in any research, we take the first thing we consider is like we assess the socioeconomic background, because it's based on that socioeconomic background. The other attributes are dependent on the socioeconomic background of a person.
Thank you, ma'am. Thank you so much for your wonderful presentation. Is there any question from participants? Okay. I think that's all from participants. Thank you, ma'am.